ctDNA has been around for many years, and it started out as target specific. So we may be looking for EGFR mutations in the peripheral blood, and then evolved to targeted next generation sequencing platforms, and has moved on to, in some cases, whole genome sequencing. So there are different approaches depending on what the indication is. And I think that there are numerous areas within the diagnostic and treatment path that a patient may benefit from the use of circulating tumor DNA. Now, I think, my talk was about early detection, and it may be that early detection is one of the most challenging areas. But certainly what is very clear is that using the newer platforms, targeted amplicon sequencing, or whole genome sampling with low coverage across the whole genome, looking for effectively aneuploidy in the blood, one can detect the vast majority of stage 3 and stage 4 tumors. Now, the implication of that is that one can then follow response to therapeutic intervention using these markers. And the evidence is emerging that, for example, in the perioperative phase, when individuals who are undergoing surgery for earlier stage disease may have evidence of circulating tumor DNA at the time of surgery, then those individuals, compared to the ones where there is no readily detected circulating tumor DNA, there's a hint that that may have a prognostic impact. So in other words, the fact that you've got circulating tumor DNA detectable at those earliest stages may indicate that you're at a higher risk for relapse. There's the potential to use MRD. What's not clear is how it's going to impact on patient outcome. So there is reasonably good evidence that in isolated cases, the detection of a biomarker informed by the original tumor, so a particular mutation that reemerges, may reemerge significantly in advance of the clinical manifestation of that disease. And there is evidence of that from the TRACERx trial, for example. The question is whether that's going to alter treatment. So at what point does would one be able to use that biomarker to intervene? And those trials are not available yet. So that's the next challenge in terms of the longitudinal monitoring of circulating tumor DNA biomarkers. I think it's a tremendously exciting opportunity, and it feeds back to what we were saying earlier about patients coming for a CT scan versus a blood test, which is more acceptable, which is more patient-centered approach, and how to integrate that in our country into the NHS practice. So these are significant challenges, but it's certainly a very exciting time for the field.